What is an antibody or a monoclonal antibody? How does it exactly work to help patients that are COVID-19 positive? What treatments are monoclonal antibodies that are currently FDA authorized under the emergency use protocols for treatment of COVID-19, as well as different things that you need to know if you are treated with a monoclonal antibody treatment for COVID-19. Hi, my name is Dr. D, the PharmD, and this is another episode of Real Talk Health. On today's episode, what we're going to do is discuss monoclonal antibody treatment with respect to treatment for COVID-19. During this video, we're going to go over what is an antibody or a monoclonal antibody, how does it exactly work to help patients that are COVID-19 positive, what treatments are monoclonal antibodies that are currently FDA authorized under the emergency use protocols for treatment of COVID-19, as well as different things that you need to know if you are treated with a monoclonal antibody treatment for COVID-19. So let's go ahead and get right into it. So what is an antibody? An antibody is a protein that your body normally produces in response to foreign invaders, such as bacteria or viruses. Those antibodies help to trigger a cascade of your immune system to help fight it off, whatever the infection is. So if you want to think of antibodies as almost like little soldiers that are the point people, so to speak, for the immune system in response to an infection, you can think of it that way. So what are monoclonal antibody treatments specifically? So monoclonal antibodies are something that are not new. They've been used for decades. Particularly for my practice, we see it a lot with patients that are treated with multiple sclerosis agents. You may see it treated in patients that have chronic migraines for some of the newer treatments that are available. You can see them used in oncology. Monoclonal antibodies are something that have been used for a long time to treat a variety of different conditions. Once we've identified the specific targets, so to speak, to tailor those monoclonal antibodies to seek out. Now, with respect to COVID-19, these monoclonal antibodies are specifically targeted for the spike proteins that are on the surface of the actual COVID-19 virus itself. So when a person becomes infected with COVID-19, it would make sense that, one, they would need to have as many antibodies created naturally or either put into their system with this monoclonal antibody treatment as quickly as possible so that the immune system can fight off that infection. So how are monoclonal antibody treatments administered? As of right now, the FDA has provided emergency use authorization for a number of different monoclonal antibody cocktails, so to speak, or mixes of monoclonal antibodies for the treatment of COVID-19. Now, most often you will see these products that are administered via an IV infusion for the treatment of COVID-19. However, there is also data to support and research looking at the administration of monoclonal antibodies for the treatment of COVID-19 under the skin or be administered subcutaneously via an injection. So I'm sure there'll be more to come from the FDA in the coming months about subcutaneous administration of these monoclonal antibody treatments. So what are the different products that have been authorized by the FDA for emergency use for the treatment or prevention, so to speak, of post-exposure prophylaxis of COVID-19? So I want to take a moment to share my screen with you. And I'm going to leave a link to this particular website in the description box for the video. But this webpage is the FDA's Emergency Use Authorization website, in which you can see different information about, what is an emergency use authorization, what COVID-19 products have been authorized under this emergency use authorization, including vaccines and products that you can use as an outpatient for patients who meet certain criteria. So I'm going to click here at the COVID-19 EUAs and particularly want to click to the drug and biological therapeutic products. So this basically provides a listing of what products the FDA has provided emergency authorization use for the treatment or post-exposure prophylaxis or post-exposure prevention of COVID-19 infections. So as you can see here, there have been a number of different types of products, some monoclonal antibodies, which you can identify by MAB at the end of the generic name for the compound. Particularly, there's been a combination product, bamlanivimab and etesevimab, that was actually paused for distribution. There were some questions about the data as far as its effectiveness on some of the recent variants of COVID-19, so there was a pause in the distribution of that product. You may see Regenco or casirivimab and imdevimab discussed a lot, or maybe even available at different treatment sites in your area or hospitals at your area. But this is a combination cocktail product that is approved via emergency use authorization. So not FDA approved like our normal FDA approval products, but this is authorized under emergency use authorization because FDA approval takes a lot of paperwork and a lot of time. So the FDA recognized that we are in a pandemic state and the paperwork cannot wait. And based off of the clinical studies, there is strong definitive evidence for supportive use of these products. So when we look at this particular website, you'll see on the right-hand side, there's a number of different clickable links where you can see, the fact sheet, which provides information to both patients as well as healthcare providers on the use of the Regenco for the treatment of COVID-19 positive patients. Over the summer of this year, there was a expansion of the criteria of use, meaning there's a set criteria in which the FDA has authorized use of this product. And if you take a look here, this FAQ provides a good summary of the frequently asked questions about what is the criteria under the EUA authorization from the FDA? So something to note that these monoclonal antibody treatments are not for patients that are hospitalized due to COVID-19. So these monoclonal antibodies are treatments that are authorized for patients that are not in the hospital, that are diagnosed positive for COVID-19 and are considered a high risk for progression to severe COVID-19, including hospitalization or death. Again, this particular product, the Regenco, is only authorized for patients that are age 12 and older and weigh at least 40 kilograms. Now, something to also note, that the patients that are included in this emergency use authorization include post-exposure prophylaxis. So what the term post-exposure prophylaxis means is a patient who is exposed to someone that is definitely confirmed COVID-19 positive, and you're concerned that that person may develop COVID-19 infection from being in close contact with that other person who was confirmed as COVID-19 positive. So under this emergency use authorization for post-exposure prophylaxis, meaning trying to use the monoclonal antibody to prevent COVID infection in a patient that has not tested positive for COVID, but was confirmed in close contact and at high potential for receiving a COVID virus from somebody that was diagnosed as COVID-19 positive. So these patients that are considered high risk for converting into a COVID-19 infection would be those who are not fully vaccinated or who are expected to mount an adequate immune response to complete the COVID-19 vaccination. So meaning patients that may be immunocompromised, have been exposed to somebody who for sure has COVID, and who are at high risk of exposure to an individual infected, again, with COVID-19. Whether it be in the same institution, a family member, what have you, those scenarios where there's a high likelihood that they could become positive. Again, we want to look at this information. If you have questions about the emergency use authorization, I've again put the links to the information I'm going over on this video in the video notes underneath. I also wanted to show you all that you can go directly to the website for the makers of REGEN-COV at going to regencov.com and finding out any information on that site as well for both patients and healthcare providers. It's also important to note that one of the criteria for eligibility for treatment of monoclonal antibodies for COVID-19 is that the patient has onset of symptoms within 10 days before receiving the monoclonal antibody treatment. So time is of the essence when it comes to COVID-19. Let's say there's a patient that is not super severe or sick enough to be in the hospital. It's best that they seek treatment and see if they meet the eligibility criteria for the monoclonal antibodies sooner rather than later. Now, the monoclonal antibodies have been shown to significantly decrease the length of the symptoms from COVID-19 and help patients to improve faster. So again, it's really a benefit that if you are considering monoclonal antibody treatment, to seek it out as soon as possible. If you have questions or concerns, you always want to make sure that you discuss that with your healthcare provider. Don't just take the advice that you hear from everywhere or anywhere on the internet. Make sure you talk to your healthcare provider before or if you're considering these types of treatments. So what's the difference between these monoclonal antibodies and the vaccine? Well, the vaccine provides longer protection against COVID-19 compared to these monoclonal antibody treatments. So if you think about the old saying of you teach a man to fish, he will eat for the rest of his life, versus if you give the man the fish, he'll only eat those fish for a day. So the vaccine is essentially teaching your immune system how to fish. So when your immune system or your body comes in contact with COVID-19, once you're fully vaccinated, your immune system knows how to handle it, neutralize the COVID-19 virus invader. Now, with monoclonal antibodies, you're basically flooding your system with these antibodies immediately, and having those antibodies that are injected into your system help to take out that COVID-19 infection. So that's why it's important to still make sure you're getting vaccinated. So the other question I hear a lot is, how long does the monoclonal antibody provide protection against COVID-19? Well, the jury is still out on the definitive hard numbers, as it's seen a large range of variability in clinical studies as far as the duration of protection it provides. So it's quoted to have protection of about a month. Some literature says about 2 months with the monoclonal antibody. So you definitely want to consider getting vaccinated for sure to have that long-term immunity protection that lasts longer than just 2 months. So according to the emergency use authorization for the vaccines, one of the screening questions that you may get is, have you had treatment with monoclonal antibodies for COVID-19 or convalescent plasma for the treatment of COVID-19 in the last 90 days? Now, it is recommended that if a patient receives treatment with a monoclonal antibody for COVID-19 or convalescent plasma for the treatment of COVID-19, that particular individual waits 90 days after receiving those treatments to start their COVID-19 vaccines. That is included in the FDA emergency use authorization for COVID-19 vaccines, regardless of which brand you're looking at, whether it's the Moderna or the Pfizer or the Johnson & Johnson. It's advised to wait 90 days after receiving monoclonal antibody treatment or convalescent plasma treatment for COVID-19 to receive the COVID-19 vaccines. The other question I hear is, are there any side effects for the monoclonal antibody COVID-19 treatments? And are they similar or different than the side effects that can happen with the COVID-19 vaccines? So these are very different molecules that are being used as monoclonal antibodies. The side effects that can happen with monoclonal antibody treatment for COVID-19 are very minimal, if at all. Sometimes patients have reported that they have worsened symptoms of COVID-19 temporarily. When you think about it, you're injecting those antibodies, you're ramping up that immune response. So you're going to feel tired, maybe a little bit more achy, but your body is basically kicking into 10th gear and fighting off that infection as hard as it can with those new Army recruits of the monoclonal antibody. Another question people may have is, will these monoclonal antibody treatments cost anything? So there are a number of different government sites that are distributing and treating COVID-19 patients with these monoclonal antibodies. And from what I have seen, they are not charging patients for these treatments. So the next question you may have is, where can I find a monoclonal antibody treatment? Well, that's a very good question. And I actually made a video last week about the step-by-step process of where to go, as well as the website links to type in your zip code and find the closest monoclonal antibody treatment to you. So take a look at that video if you have not already. And this has been another episode of Real Talk Health. And feel free to leave any questions, comments that you may have underneath the video, and I will be sure to make sure that I provide a response to those. So see you guys next time.